Welcome to the NMSK Podcast from the American Osteopathic College of Physical Medicine and Rehabilitation, the AOCPMR, the home of osteopathic physiatry since 1954.
Welcome to Grand Rounds Reimagined. We explore physical medicine and rehabilitation through an osteopathic lens, one conversation at a time. I'm your host, Dr. Haroon Andar. So grab a cup of coffee and let's get into it. Welcome to the first ever episode of the Neuromusculoskeletal Grand Rounds podcast presented by the AOCPMR. My name is Dr. Haroon Andar. I am your host, double board certified interventional pain management physician and PM&R physician. My first ever guest here is the president of the AOCPMR, Dr. Amir Mahajer.
Thanks so much, Haroon. We've known each other for like many years, right? Like 16, I think.
Yes.
I'm also double board certified, but in physical medicine and rehabilitation and sports medicine. I did an interventional spine and sports medicine practice, and then I basically practiced somewhere in the realm of interventional pain management and kind of regenerative sports medicine.
Great. Amir, I know you a little bit more than some of the other people do. Tell me a little bit about, you were in Manhattan, right? That's where you did your fellowship at the Mount Sinai Icahn School of Medicine. And you came back to Miami and you went back there, and now you're back in Miami, correct? You have a practice called Osso Health.
That's right. So I trained down in Miami where we trained together after med school, and then went up to New York to do fellowship in one of the premier spine centers. Then came back down to Miami, and now I'm in a private practice. It's been a very interesting and fun last 2 years working on all the private practice, administrative, things like that. So it's been a nice challenge.
So let me ask you this, because a lot of residents are coming out of residency, fellows coming out of fellowship. There are some people that do think about entering private practice, building up their own practice. Some go for a hospital job. Your case is kind of more traditional in a modern sense, I would say. You went with the hospital system at first before you transitioned out to private practice. How did you like that experience, and what is some information you would give for someone who wants to make that transition out toward building their own practice?
Absolutely. So there's a lot of different practice models to work in physical medicine and rehab. You can own your own practice doing inpatient, or you can work for an organization and do inpatient. There's a lot of different companies that do this, but say if you're graduating and you'd like to open up your own company, like say that's you're an entrepreneurial spirit and that's what you have intentions on doing, some recommendations I'd tell you is have a window, a runway window where you can develop certain things. Those would be like regulatory and credentialing things. The minimum time frame is 3 months. So I would recommend that you do like at least 6 months if you can afford it, up to 12 months. That allows you to set up your business, your LLC, set up all your credentialing, get your mailing address set up, get your licenses for Medicare and things of that nature. And then you'll need a business address for that. So what you want to do is get your business address set up, get your LLC set up, work with an attorney, a business attorney, to try to get those few things kind of together. And then med students and residents, like here at AOCPMR 26, I've had a student just ask me, it's like, how do you go about doing this? And I was like, well, the first thing you can even do as a medical student or anybody is start building up your own marketing, your own online presence, put together a website, and anytime you're reading a book or something, put together a blog and send it out there. You'll never regret starting that earlier.
Yeah, no, I totally agree. There's a lot of, residents that come up to me and ask me the same thing. I'm like, this is your time. Build your brand, build your name, make your name known nationally if possible. Yeah. So I completely agree with you on that. I do want to take a second to say that, I know you've been the president of the AOCPMR and you've been involved in the organization for quite a while. You were even the resident council, if I remember correctly, the head of the resident council. So why don't you kind of tell us, like, at what point, you were part of the resident council, you stayed committed to this organization, you rose through the ranks and became the president. What was some of the things that kind of made you decide, like, look, I really love being involved in the AOCPMR. I want to have a strategic vision and be part of this long term?
Well, it goes all the way back to mentorship. I was a student. We were lucky. We went to Lincoln Memorial University, DeBusk Osteopathic College of Osteopathic Medicine. We had a strong mentorship with through Dr. Michael Whiting, who's kind of like one of the godfathers of physical medicine rehabilitation. We both got interested in physical medicine rehab early. So it was that mentorship that basically brought me into the organization, I guess. And then it was the organization itself, the camaraderie, the mentorship through multiple different facets, whether that was like Dr. Ricky Goldberg, Dr. Rob Gotlin. Many of these physicians would take you out as a student, talk to you about real life things in clinical practice, whether that is working in a large orthopedic group, working for a hospital, or whatever. It's just really the camaraderie, mentorship, and that is why I'm in it still, is because I received that mentorship and I like giving that mentorship as much as I can.
And it's really interesting that you say that, kind of giving back. I mean, you and I both know I wasn't very heavily involved in AOCPMR. It was
Until I
actually
pulled you in.
until you pulled me in. Yeah, you gave me a call this fall and you said, "Hey, Haroon, I'd love to have you in, be part of the communications committee. Have you thought about maybe we should do like a podcast for the organization?" And honestly, at that point I hadn't really given anything back to the osteopathic physiatry field. So I said, you know what, this is perfect. I would love to get involved. And I think we've done a pretty good job. I know we started off in a phone call conversation with the idea of building this podcast, and we have managed to now make what was a dream into a reality. And we've had a great weekend. There's so many people that have been trying to come on this podcast, and even students, residents, everyone has been so receptive toward this idea. So
Yeah, thanks so much for coming on, for chairing the communications committee. We've gotten a lot of legwork done on social media and the website. So I do appreciate that.
absolutely. And let's talk about something else. You know, you kind of channeled it. You talked about Dr. Michael Whiting, right? Who not many people know, but he was a professor at Lincoln Memorial University, where we both went to. At that time, PM&R was considered to be the best kept secret, right? You remember,
Right.
like no one really knew what PM&R was, and I didn't even know what PM&R was. I was a second year student. I was really not interested in some of the other fields of medicine at that point. It was a little bit discouraging.
Mhm.
And then there was someone else who said, "Well, have you thought about PM&R? You seem to like musculoskeletal medicine." I said, "No, not really." And he said, "Dr. Whiting, we have a club, a PM&R club. Why don't you come join for a meeting?" And Dr. Whiting came in and he just blew me away at that point. You know, I said, "This is probably what I want to do." Um, Not many people are lucky to have a Dr. Whiting or someone
Right.
in PM&R at a high academic position. It tends to be dominated by the other fields
Mhm.
of medicine. So from that, you know, what is something you do to kind of bring? Have you noticed a shift in it not being the world's best kept secret anymore? Now it's a known secret that's out now.
Yeah, interesting you say that. We had our fellows conclave meeting, and we're discussing this basically. So the secret's out. Yeah, yeah, secret's out. So everybody knows physical medicine rehab is one of the best specialties, especially particularly for lifestyle, and also now it's very much like internal medicine, where we have so many subspecialties like fellowship training that people are going to, whether that's TBI, spinal cord injury, basically like critical care, physiatry, pain medicine, sports medicine, or some hybrid practice. The fun thing about physical medicine rehab is literally you can go in the morning and round on in a subacute nursing home, and in the evening be implanting a spinal cord stimulator. Like you can kind of do a little bit of everything. So yeah, I think the secret's out. Also, osteopathic medicine, the numbers are like 87% match rate or something like that in this most recent match into physical medicine and rehabilitation. And we have an almost 50%, I think it's like 43% osteopathic physicians matching into PM&R residencies. I'm talking about MDs and DOs. So DOs are going into that at one of the highest rates of any other specialty. Maybe by numbers, primary care probably beats it, but by percentage, we by far succeed. And probably has to do with our efforts in building up our students. We've done so much for the last 10 years, including like our involvement, right,
Yes.
as students to get into this organization. So I think you'll see a correlation there between how much the AOC PM&R mentor students and then osteopathic students matching into PM&R. So it's a good case to be a member.
It's funny you say that. Like 30 minutes beforehand, I was just talking to someone here at the resident fair, and I said, "What do you do?" And he said, "Peds, PM&R." So it just shows you just how diverse the field is. And I was like, "You've got to be probably the second Peds, PM&R guy I've ever met in my career." But we're so spread out in different subspecialties. I think it's extremely interesting that as someone who's in the interventional pain field, I'm so used to going to pain conferences, right?
Mhm.
And then I come here and I meet these people that are in spinal cord injury, traumatic brain injury. And I just actually met someone that runs the first ever fine arts fellowship. It's like a co-founder of that, which I thought was extremely interesting. When she told me this, I said, this is something you don't hear about. So definitely the diversity of the field is a is a very positive aspect to it. So
Yeah, like you said, there's so many different niches, like fine art medicine in physical medicine rehab in physiatry. I think our organization maybe is the best kept secret right now, but we are definitely like doing things like this podcast, like the neuromusculoskeletal branding for the podcast, for all of our workshops. Our typical branding is like we're the home for osteopathic physiatry, or like how I like to say, the osteopathic minded physiatrist. But I think we should like rebrand that. We're the home for the fun functional physicians, like literally anybody, like neurologists specializing in pain management, or orthopedic surgeons specializing in minimally invasive techniques. Like all of that converge, and like that's kind of like what you learn here. We had an orthopedic surgeon talking about tendon problems and Tommy John surgery and all that just now. So I mean, it was amazing.
great. And I guess I'll ask you, as someone who's been involved in the academic part of
Mhm.
PM&R, and it was the president of the AOCPMR, what advice would you give if I am, let's say, I'm an MS3 or an
Mhm.
MS2, and I'm possibly interested in PM&R? What is, and I get this a lot too, like people messaging me on Instagram. I don't even know how they find me, but they're like, I heard you're PM&R, and how do I get in? What is some advice you would give to an aspiring student that wants to match into PM&R?
So number one, you want to do a rotation. You want to like the primary field. So you're going to want to do something that's a little bit more inpatient, also something that's outpatient. Um, Also, PM&R goes across the board, right? So you want to do rotations through neurosurgery, urology, because we deal with a lot of bowel and bladder issues. With a urology rotation, will give you some benefit to that. We deal with spinal cord injury, brain injury, so a neurosurgical rotation will probably help you with that. You're asking like, what can they do to improve their application? I get that question too as I mentor people. I also interview at FIU, which I'm doing on tomorrow, Monday. So it's kind of best to be kind of good across the board. Don't hedge on one thing. Kind of put yourself so that way you have enough. You have some research experience. You have some organizational experience, like working with the AOCPMR, and we have lots of student leadership possibilities. So look into organizations such as ours, as well as be good clinically, be involved. The only thing you have to do on a rotation is show up and be interested. No one's expecting you to have an attending level of knowledge. Just show up and be interested and be there. And then just kind of be as broad as you can. Also, volunteering is really important too in your community. We have the Rob Gottland Community Grant, which we give money, scholarship money, for you to do projects in your community. So take advantage of that. Look at our website, see what kind of money you can get. Look at industry sponsors to get money and donate to your community, and just work hard.
We talk about the diversity of the field and inpatient, outpatient, general rehab, musculoskeletal. What field do you, I know you do sports and spine, but what does your day to day look like? Do you do strictly outpatient, or are you doing any inpatient right now? Or are you involved in anything with that? Or take me through a day to day in the life of Dr. Amir Mahajer for you.
Right. So I am in an outpatient musculoskeletal center. So being in private practice, there's a lot of administrative duties that I do as well. So I usually wake up, I'll do like a scan through my email box, make sure that there's nothing critical. I do have administrative staff that we have a shared inbox, so hopefully they'll take care of some things if I do miss them, or if they're like kind of more contractual administrative billing associated. So I do a clear through my inbox. I'd usually try to get my exercise like running done in the morning, and then it's straight to the office. In the office, it's a combination of seeing office patients, doing in-office like ultrasound guided procedures, whether that's like a regenerative procedure or nerve block type procedure, and also administrative things like marketing the practice, branding, building out the website, reviewing contracts, whether that's for getting onto a new payer or getting a new clinic site. And then another day might be like starting in the surgical center, doing a couple advanced procedures, and then going off to doing a networking event with some physicians. So every day is a little bit different. I don't do any current inpatient work, but I'm not against it. As a physiatrist, inpatient, you could moonlight or go work at you could do some coverage for an acute rehab facility, or you could also do acute pain service, right? So you could get I have hospital privileges, but that's because I work at a surgical center. If should there be some things that happen, you have to have privileges to admit the patient.
Great. And I believe you're pretty much wrapping up your tenure as the president of the
Yep.
AOCPMR, correct?
Yep.
When is that time frame exactly?
So we do a 2-year term now. So this is the end of my 2-year term.
Okay. And where do you see yourself going now within the organization?
So according to our bylaws, you're still on as immediate past president, according to our bylaws. So I still will function within the organization and assist with certain committees as we go forward. I have my own pet projects within the organization, so I'm going to definitely stay on and work with those. But then I'm going to help mentor and bring up new leadership through the field. We've got some great, the next incoming president, Dr. Joseph Brooks, is amazing. So I think the organization has a very bright future.
Yeah, I definitely have to echo that. From my experience this weekend, the organization is in a tremendous position. And I like the fact that it really modernized itself this year in particular. The vision that you kind of brought up, and then with everything that we've kind of been doing this weekend, I was absolutely floored by everything I saw. So I definitely think AOCPMR is headed in a great place in the future. So hopefully the incoming leadership will help to continue to build upon that, which I'm very confident. Dr. Brooks, I met him. He has a great vision as well.
Oh, he's amazing. And the EC, and we have a fellows conclave too. So we really, we're different than other organizations. Our fellowship is not just given because you're part of the organization. You have to kind of work in committees, work in chairing, and then you are nominated to fellowship. So we have a select group of fellows. I believe we're up to 103 fellows. And you can think about that as kind of like wisdom from our experienced members, right? These are the people that have basically built up the organization. We actually have one level higher than that called the Distinguished Fellow. So we have Fellows Conclaves and Distinguished Fellows Conclaves that are like basically like think tanks and incubators of past ideas and potentially new ideas that get fed back into the Executive Council. So it's like a nice loop of experience, lived experience, new ideas that kind of build and make the AOCPMR better.
Great. Well, look, Amir, I know we're kind of pressed for time.
Yeah, we got to go to dinner.
I was very appreciative of you taking this time out to have this conversation with me. I really just got one last question.
Sure.
So again, I've known you. The listeners have not. Where do you see the legacy of Dr. Amir Mahajer being in the future when you call it quits and you hang the white coat?
Well, hopefully that doesn't happen for a while. Still kind of mid-career, so let's not do that. So I don't know about legacy, but I kind of live life in the idea that the same like when you go to a park, right? You want to leave it better than you found it. So try to treat people nicely, work hard, and just like leave the organization, the world, your patients, your family kind of better off than you found them. And I think that's the best you can do. And just try to work hard, smile, be happy every day.
Definitely. I can echo the same remarks. I think that's part of the reason why when you said to come in the organization, I said, that's the first thing I thought of. I said, I want to give back to the organization, make it better than it was before. At some point, there'll be that next generation coming in, and we want to leave it, the field of osteopathic physiatry, far better than when we showed up.
Yep.
So that's pretty much about it. Dr.
Cool.
Amir, thank you so much.
Thanks, Haroon, for taking on the lead on this. I'm looking forward to all the podcasts coming out.
The views, opinions, and factual statements presented in this video are those of the presenter alone and do not reflect the views, beliefs, and/or policy statements of the American Osteopathic College of Physical Medicine and Rehabilitation, its affiliate organizations, members, or governing council. Medical statements made in this or other AOCPMR video should not be treated as individual medical advice. Consult your physician and/or other medical care providers before undertaking or discontinuing any course of medical treatment. You may review the American Osteopathic College of Physical Medicine and Rehabilitation's full medical disclaimer on AOCPMR.org.